About 90% of people in this world need neuro rehabilitation, but unfortunately only 10% receive it. So I think there is no doubt that there is hardly anything which is more required at this time in the field of neurology and rehabilitation centers, which take care of the whole concept of rehabilitation in one. I, having my father who had a recent stroke, so I'm seeing how things are problematic at home. I know every single aspect of his movement, every single aspect of his activities of daily living is a burden on him. He has to understand every single aspect, right from getting up from the bed, going to the washroom, taking a shower, eating, and then washing his hands. So I understand it as a doctor, I understand it as a caregiver, so I also understand that what is the need of these things. We have these patients in our hospitals, and when these hospitals, they are in a situation to discharge the patient, then there are several apprehensions in the mind of these patients. And these apprehensions are that, okay, I am from a place like Ziva, I am from a place like Balia, I am from a place like Motihari in Bihar. I don't have any facility which can take care of these patients in my place. So I'm not confident enough to take my patient to those places. So I need to be in a place which is like a hospital, which can provide the medical part, the rehabilitation part, the occupational therapy part, and the caregiver part, all at the same time, under one roof, at a cheaper rate. So where do I go? This is the place where these patients would find a home away from home and a hospital care away from hospital. So that is where the transition component sets in and is the most important. We have patients with Parkinson's disease and patients who have Parkinson's-like syndromes, like Parkinson's plus syndromes. There the most important problem with them is speech and walking. I am yet to see a center or a physiotherapist or a speech therapist who is trained specifically for those components. And it is very difficult for a doctor to deliver that part to the patient. So it is basically to set up a center which understands these needs and also delivers them to the patient. So there has to be a speech center which can take care of these aspects. There are specific ways of treating these patients. Patients who have aphasia, who have language problems after stroke, there has to be a place where these types of teachings can be taken care of. Patients with proximal muscle weakness, like Gurugram syndrome, they take a very long time to recovery, and physiotherapy is probably the most important aspect of their treatment because the disease, the medicines can only be arrested, it cannot be recovered or reversed. So there is a need for such places, there is no doubt about it, and I'm really, really happy that this type of facility has come up in a place where it was very well needed. We all know that Gurugram is the hub of medical management, probably in this part of the country and probably in the whole of the country. We hardly have any other place where we have such a specialized level of medical care being offered to patients. And I really congratulate this team for creating such a wonderful center which is the state of the art in terms of the rehabilitation centers which are hopefully lacking in the country and are the need of the hour. Thank you very much for your time.